So today we're going to be talking about electronic documentation at the bedside and barcode scanning. And it's presented by Marissa, Michelle, and Rachel. Patient safety and electronic documentation are some of the biggest concepts in healthcare. When it comes to patient safety, it is of utmost priority to the nurses, doctors, and other hospital staff. Using the wristbands as patient identifiers are a great way to promote that patient safety without compromising the integrity of the patient. Electronic documentation has made its way into healthcare and has served many positives to the nursing staff as well as the physicians. It also has been able to team up with the wristbands and allow for safer patient care and identification for the nurses and staff who are also a part of that patient's care. Using the electronic barcodes and medication records together have significantly increased patient safety and nursing care in many aspects. With every new invention that goes on in the world, there are pros and cons. So our objectives today are going to be that by the end of the presentation, the audience will understand the purpose of electronic documentation at the bedside, how documenting and scanning barcodes at the bedside improves nursing care and patient safety, and lastly, practices that can decrease negative outcomes.
The first topic we're going to talk about is what an electronic health record is. In most facilities, access to patient information and documentation has been replaced with the implementation of an electronic health record, also known as an EHR. An EHR is a digital version of a patient's medical record that has substituted the need for continued use of a paper chart format. EHRs provide the most up-to-date information that is centered around the patient that is available instantly and securely to only authorized users. Data entry into an EHR can be created, stored, recovered, managed, and consulted by authorized providers and staff amongst one or possibly more healthcare organizations. Some of the vital information that is recorded in an EHR involve medication administration, client assessments, progress notes, care plan updating, client acuity, and accrued charges. When accessing an EHR, security measures are placed in order to ensure appropriate care and treatment for each patient. The most important of these measures is identifying the patient against the medical record. Wristbands are the primary source that the hospital staff uses to determine they have the correct patient. The two most common patient identifiers found on the wristband include the patient's first and last name along with their date of birth. If the patient has it memorized, they also have the option of reciting their medical record number. It is a crucial part of every medical personnel's job to identify the patient prior to unit transfers, medication administrations, specimen samples, and among other scenarios. Doing so ensures patient safety, reduces errors, and allows viewing of the appropriate patient medical record. Next, we're going to talk about the purpose of electronic documentation and barcode scanning at the bedside. The primary purpose of always scanning the patient at the bedside is to ensure an extra level of patient safety with hopes to reduce human error. To heighten the awareness of safe medication administration, the system automatically generates real-time warnings and approvals once the patient's wristband and medications are scanned. Barcode scanning at the bedside also promotes compliance among the nurses by requiring them to physically check the patient's identity instead of scanning the patient's barcode from a piece of paper. Scanning also assists in analyzing data to monitor certain trends. An example of this is the amount of doses that are administered late. Other purposes of barcode scanning and electronic documentation include improving inventory control, providing accurate billing procedures, and increases operational efficiencies.
So some pros or benefits of electronic documentation at the bedside include ease of use, wristband durability, electronically verifying the 5 rights of drug administration, prevent or reduce harm to patients related to medication errors, checks and balances at each step of medication administration to admit errors, supplying a double check method for the bedside nurse. A few other ones include help streamline the patient admittance process, track medication and care admission, identify patients throughout their entire stay, trace critical patient information by easily accessing records through barcode, eliminate manual data collection, allow all patient information to be easily and instantly collected and recorded electronically, and reducing potential human error. Electronic documentation improves nursing care by ease of use. This does not require complicated actions. Simple to scan barcodes are on wristbands and medications. The software is user-friendly for staff. Hospitals that already have laser printers can easily adapt to laser wristbands. Day-to-day use is immediate and effective, and nurses can spend more time charting at the bedside of their patients instead of away from them. Electronic documentation also helps promote patient safety. No other barcode will identify the patient during their stay at the hospital. Like I said, it promotes privacy of the patient, reduces transcription and medication errors by 41%, reduces drug-related adverse effects by 51%, and it supplies a double check method for the bedside nurse. This includes extra safety checks, but it still requires critical thinking.
Okay, so some impediments to point-of-care documentation include the location of the computers in the room. Sometimes the nurses have to ask visitors to move, turn their backs on the patients while charting, or they have to chart standing up. Another point is the unreliability of computers in the patient rooms. Sometimes they may be slower and often freeze up. Another point is the privacy concerns. Visitors often may look over the nurse's shoulder, or they can read the patient's chart, which is what we don't want to happen. Another point is that it could be the patient's preference. Some patients dislike the nurse charting in the room or complain that the lights emitted from the computer monitors disrupted their sleep. While the nurse documents in the room, the patients may interrupt them with questions and/or requests, which can prolong their documentation. And finally, battery life failure of the scanners may occur.
We're going to explore a few disadvantages to electronic documentation. There are a few negative aspects of the electronic documentation process. One of the most important aspects may be the transfer of inaccurate information if the system used allows features for copying and pasting. Many times, assessments show the same patient documentation for many shifts without any updates. Most electronic healthcare programs have narrow charting. This means there are not enough choices to accurately document certain findings or reflect the care given at each patient interaction. Most times, nurses are trained to chart by exception, meaning they only chart the minimum information needed so there are no legal ramifications if a patient has a lawsuit. But this does not paint a complete or accurate picture of the care being provided to the patient. Bad habits are easily formed and not corrected, which can cause errors to take place. There are many medication documentation instances that a medication was given when it was not. There are also many shortcuts taken regarding wristband barcode scanning at patient bedside. Because the same barcode exists on patient labels in the charts at the nurse's station, it is commonly seen that labels are placed on S-bar reports and scanned there instead of actually being at the patient bedside. Aside from negative aspects with patient care, there are many privacy concerns with electronic documentation. Privacy of information in the hospital is always endangered because the patient information travels around with the nurse readily available on mobile workstations. Privacy screens are supposed to be used, but they cloud or dim the view for the nurse, so they are rarely used. We also want to prevent unauthorized access with mobile workstations being in the hallways. They can easily be accessed. Sometimes hospital computers are accessed for personal use. There's narrow charting, not enough selections in the patient care process to document, and then no free forms available in most systems to give a clear picture of the care given. There are a few practices that can reduce the risk of patient information and safety being compromised. One is due diligence to chart accurately, random and ongoing chart audits, and also re-education if the nurse charting does not improve. It is impossible to completely prevent unauthorized access to patient information because some information has to be shared with third parties, such as police, DMV, and state government agencies. The cons on electronic documentation are important, and they are not taken lightly. However, the pros for patient safety heavily outweigh these negative aspects. Therefore, electronic documentation will continually be evolving to reduce risk, become more streamlined, and increase ease of use, along with improved measures to keep patients safe and protect their information. These are our references. Thank you for listening.